There's been an exciting new potential solution to the coronavirus COVID-19 outbreak that's not being discussed nearly as much as it should be. Now, that's probably because most of the conversation is surrounding vaccines as the long-term solution to this issue. But this has the potential to be a real game changer, and I want to explain why. Now, it's called rapid at-home testing. So at the outset of the pandemic, there was a lot of proliferation about how testing was going to be the key to this thing, how we needed to identify who was infected with the virus, remove them from the population, get them into quarantine, and really how testing is the only way to effectively reduce the R0 rate of spread. The reason why we moved maybe away from that into more of a vaccine discussion as a population and as the medical community has looked at it is because the standard PCR testing that is, at this point, it's the gold standard for the coronavirus, that takes far too long to get results. You need a medical laboratory, you need medical professionals involved. It takes a few days to get the results back. So really it reduces the effectiveness of getting that person the positive test, pulling them out of the public and into quarantine quick enough to keep them from infecting anybody else. But this is something new. This is something very different, and I'll explain why. Rapid at-home testing works, or could work, like a pregnancy test, if you follow. It doesn't take any special equipment or special experience or medical facilities to process. It's very intuitive, user-friendly, relatively inexpensive, and you can get results in as quick as 15 to 30 minutes. Now, you could see why this could have the potential of maybe every citizen testing on a daily basis, and how quickly that could eliminate this outbreak. It took a while. It may have taken a little bit, but technology is starting to catch up now with this strategy. Some companies like E25 Bio, E25 Bio, I'm going to link to them below, they are very close to actually being able to mass produce this thing and do it in an inexpensive enough way so that every American can access it. Now, let me quickly explain a few scenarios and explain why this is a game changer, right? And has the potential to be the long-term solution for this thing. Imagine an economy and imagine a society where every single citizen has the opportunity, at least, to opt in and do this daily testing before they want to interact with the public or with their family. Let's say you want to go to a restaurant, right? Before you go, you do one of these relatively inexpensive, quick, rapid at-home tests. You get your negative result, you timestamp it, you show the facility, the restaurant, the ball game, whoever you're doing the reservation from. They see the time-stamped negative result, boom, you're in. A little degree of normalcy is back, right? Even if you want to get together with family, everybody takes that daily test. Again, it's accessible, it's less expensive, you get those negative results, everybody gets together with a slight degree of at least less anxiety than they normally would during this time, right? You can get together knowing you're not going to spread a possible infection with so many people being asymptomatic while they have it. So I'm sure you can connect the dots and see why this is such a huge game changer, but this could possibly change everything for small businesses, for appointments that we have, for the economy at large. Even bigger gatherings at some point could be effectively allowed with this strategy. Now, it's not as accurate as the standard PCR tests, right? But even with that less degree of accuracy, it could still be effectively incredibly effective at blunting this thing, because the rapidity in which a person can get that positive test result, that can trigger them instantly to go to advanced medical care, to go get one of these PCR tests, to get quarantined, and that still, even with less of an accurate outcome, is going to eliminate hundreds and hundreds of people from going out into public infecting people possibly. So this thing could be affordable, it could be mass produced, it could effectively stem the tide of this R0 rate of spread while giving your family a chance for a little bit of normalcy while you use it for your day-to-day activities. I think this is incredibly important. I think this conversation needs to be pushed into the forefront, and I think we should do it.